Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health System. Today, Brad and I are broadcasting from our administrative offices, and our special guests are Dr. Elsworth Beach, Dr. Stephen Kelly with Aultman General Surgery, and Dr. J. Patibandla, surgeon with Aultman Gynecological Oncology. Good morning and welcome to the show, doctors.
Morning.
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 We'd like to remind our listeners today that our program will also be available on our podcast. You can go to the App Store and download your favorite podcast app and just look for Health Matters with the Medicine Center Pharmacy, and please subscribe to our program. Aultman General Surgery provides a broad range of general surgical services. State-of-the-art treatments include robot-assisted minimally invasive procedures, colon and rectal cancer surgeries, comprehensive breast care, abdominal and gallbladder procedures, hernia, and vascular surgeries.
So good morning, Dr. Beach. Please tell us about your background and training. How long you have been practicing at Aultman General Surgery?
So I've been at Aultman now for 3.5 years now, which flew by. It's kind of crazy how quickly that all goes by. I did my training up at Western Reserve, which is in Cuyahoga Falls, so just right up Route 8 there, so not too far away. And in terms of my practice is general surgery, so robotics is included in that, which we'll talk a lot about. But I also do some trauma surgery as well.
So those procedures do you perform at Aultman and at all locations?
Yeah, so me personally, I'm based out of Canton 4 days a week, and then 1 day a week I'm actually over in Alliance. And we'll touch base on, we just got a robot out there over in the fall. And so that program's up and running and is great, for that area over there that doesn't have to drive all the way out here to Canton.
Wow.
Okay, Dr. Patibandla, can you tell us a little bit about yourself, your background and training, and how long you've been at Aultman Gynecologic Oncology?
Sure. No. So I also have been training for a while, and it's kind of it's flown by. I actually did my residency training here at Aultman back and starting in 2013. Did about 4 years of residency there. Graduated as an attending, and then came back to the area in around 2019 to practice. Recently, I just joined gynecologic oncology within the last 2 to 3 years. I'm an OBGYN and gynecologic surgeon by training. I work with two other GYN oncologists who take care of cancer and pre-cancer. I do a lot of complex surgery, things like that.
What type of procedures do you perform and at which locations?
So I perform things like hysterectomies, which involves removing the uterus, salpingo-oophorectomies, the tubes in the ovaries. I do prolapse surgeries, and a variety of other kind of surgeries that are not necessarily robotic. I operate in Canton. I also, like Dr. Beach, operate in Alliance, and I have operated in Orville and from time to time.
So, Dr. Kelly, tell us about yourself, background and training, and how long you've been at Aultman General Surgery.
I'm the old man of the group now. I was actually born and raised in Stark County. Went to medical school, Case Western Reserve, and did my residency there in Cleveland. After a short stint in the Air Force, I returned to Canton, and I've been at Aultman for 23 years now. In addition to my role as a general surgeon, I'm also the chief medical officer for the Aultman Health System. I'm the first general surgeon to do robotics at Aultman, and that was in 2016 that we started. And I've really changed my practice. I do a comprehensive general surgery practice that focuses on robotics. So everything from hernias to colon cancers, gallbladders, hiatal hernia repairs, and I help support Dr. Beach and the rest of the general surgeons.
Wow. I'm curious about the Air Force. I was in the Army as a pharmacist, and I was wondering where you were in the Air Force.
My first duty station was Robins Air Force Base in South Georgia. I then was transferred to Wright-Patterson, and while in Wright-Patterson, I had the opportunity to spend some time in the Middle East, both in Saudi Arabia and in Muscat, Oman.
Wow, interesting. So, robotic surgery apparently has become very, very large in Aultman. How many robots do they have now?
We have 5 robots now. We purchased
Gosh.
our first in, I think, 2010 at the Canton campus. We didn't add a second robot until 2018. Since that time, our growth has been close to exponential. We then got a robot out at Orville. We added a third system at Aultman Canton campus because of volume and access issues. And then finally, as Dr. Beach of Patibandla stated, just last year, we placed a 5th system out in the Alliance market.
I guess I wasn't aware that a lot of surgery happened in Alliance. Did that just begun over there, or has it been all along?
No, Alliance as part of our health system has a strong history in providing surgical services to their community and our community at large. Comprehensive general surgery, orthopedics, benign GYN, ENT, and urology procedures are performed there.
I see. Very interesting.
Okay, Dr. Beach, how about you talk about what robotic surgery systems really are and how it's used?
Yeah, so the system is fantastic, but essentially you're using a camera and some small instruments that are attached to a robotic arm, and the surgeon is in the room with the patient sitting at a console that are then controlling those instruments, which really allows us to do a variety of things, as we'll talk a little bit more about. But that's why it's called robotic assisted, because even though the robot is in the room, we're the ones controlling it in the entire case.
I had a patient come in the pharmacy at one point, and she said, I heard that they're going to do robotic surgery on me, and I don't want a robot. I want a doctor doing surgery on me. And it was just an interesting conversation, because you have all these visions of Star Trek and whatever, I guess, or Star Wars. So I thought that was an interesting conversation we had. But to her credit, she was fine and did very well.
We go to the Angel auction every year, and last year they had a robot in the hall there, and I looked at that thing and I said, "What does this thing do?" I didn't really know that it was an operable robot, and it hit me like a brick. I thought, "Oh my God, this thing's a monster!" And um, it's just huge.
Ironically, the technology was developed by the Department of Defense. The hopes were that the robot could be deployed to austere environments, and your surgeon could be away from the patient in a safer environment. Obviously, that did not turn out. So Intuitive purchased the technology and really has taken it and run.
Amazing.
Dr. Patibandla, how long has robot-assisted surgery been around?
Reports will kind of differ, but the major robotic platform that most providers use has been around about 30 years. And it's infancy, and then in the past 20 years it started to take off and really get implemented for patient care much at a higher level. Like Dr. Kelly said, after that military contract was over and Intuitive bought the intellectual property and started to implement it. It was about 30 years, I would say.
So, Dr. Kelly, how long has Aultman been using robotic surgery?
We did our first procedure, I believe, in 2010, which was a robotic prostatectomy. We do close to, I think, 1,400 procedures a year across our health system. Next month, at some point, we're going to hit our 10,000th robotic procedure that's been done across our system, and we're very proud of that accomplishment.
Wow, amazing. I think it's time for our first break, right, Brad?
Yes, it is.
You are listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for vaccine season? Stop in and schedule your flu, pneumonias, COVID, or shingles vaccine online at meditshop.com. So we might have caught this answer in the last question, but how many procedures are performed each year at Aultman using the Da Vinci robot?
About 1,400 across our system with the 3 hospitals that have the robotic systems.
Where'd the Da Vinci name come from? The inventor or?
That's a great question. I think you've stumped all 3 of us.
Okay.
Right.
I guess I always thought that was the name of the guy that invented the thing or something, but maybe not.
I think the philosophy behind that was, exploring the future, being innovative as Da Vinci was. I think the company sort of has that philosophy: is how are we going to transform healthcare and make it safer for the patient, better for the patient, and easier to use for the providers.
So you think there's a chance in the near future that you roll a patient into the operating room and underneath the Da Vinci robot, and you folks, doctors, sit out somewhere outside, and you're watching TV, and the robot just goes ahead and does it.
I hope that never happens.
And maybe not in our lifetime.
Yeah,
Yeah.
I know.
We need jobs.
Yeah, I know.
Don't we all?
Yeah, I know. Hey, we got robots in our business. What can I say? So,
Keep Doge out of it.
yeah, exactly. Okay. All right. So, surgical specialties use the robot regularly.
Yeah. So, I mean, obviously, with the 3 of us here, general surgery, gynecology and gyn-onc are the big ones, but also urology. They'll do kidney and prostate surgeries, and even thoracic. They'll do some lung surgeries and lung cancers as well.
What about in the heart? Bypass surgeries and all that sort of thing. Is that part of the game there?
In the past, that has been supported by the robot, particularly valve surgery. If you look at the history of robot, Intuitive purchased the technology really because they thought there was going to be a space for it in cardiac surgery with bypasses and valve replacements. And the joke in the industry is they aimed for the heart but hit the prostate.
Okay. That's quite a difference. There's quite a space there between those 2 items. You're good. Okay. How was the training process for adopting robotic assisted surgery, and how has your confidence in use the system evolved over time?
I think that's a great question, and it's good to have all 3 of us on because we can all give different perspectives. As Dr. Kelly said before, robotic surgery at Aultman Hospital came around in 2010, and I started my training in 2013. So the robotic platform had already been there since the first day I ever picked up a scalpel to train to become a surgeon. So it was kind of integrated into my training. OBGYN residency is about 4 years, and at our institution and through the residency program, usually the first 2 years you're assisting at the bedside with the robot, not necessarily at the console performing the surgery, but kind of assisting from the patient side. And then the last 2 years of residency, you're sitting at the console, you're working and doing surgeries. So that's how it was for me, and it was just adopted, integrated to all my other types of surgeries. In terms of, feeling comfortable with the robot, I just feel as comfortable as I did with all the other modalities that I use. For me personally, and I'm sure Dr. Kelly and Dr. Beach can say this, as time goes on, you run into different, more complex situations, different types of patient encounters. And as you kind of get those experiences, you kind of index them in your brain, and you kind of build your confidence and you build your strengths and how to use the robotic platform and how to best utilize it to decrease complications, to make yourself more efficient in surgery and things like that.
So you mentioned gallbladders. because you can use it. I'm one of those guys that many years ago had my gallbladder removed and have a long scar about 4, 5, or 6 inches. Gee, I wish I wish that had been around when it came time to take my gallbladder out.
Yeah, those still happen every once in a while, but not nearly as much as they used to.
Yeah.
Um,
Interesting.
yeah, but in reference to training, so as Jay was kind of alluding to, my situation was completely different. I actually didn't use the robot at all in residency. So my 5-year residency program, I was at a smaller
Mm,
hospital. We did a lot of laparoscopic surgery, which is
mm,
similar. So I know how to do all these procedures that I do now laparoscopically. And so really the robot to me was a little bit different because I came on
mm,
coming to Aultman knowing that the robot was here. And thankfully, Dr. Kelly really pushed me very early on to get my touches, get on the system. And it, they do a great job of really integrating you in terms
mm,
of putting you in front of the system, and they send you down. I went down to Georgia one time and went down to Houston another time to practice on live tissue, well, not live tissue, excuse me, on cadavers,
mm,
and to really hone my skills and get used to the system and used to the robot, and really that way,
mm,
when you're first getting your feet wet in some of the stuff, that you're ready to go.
mm,
And then my training was completely different than the other two because I grew up in an era of training where we were converting from open surgery to laparoscopic surgery. So I was 15, 16 years into my career and took a leap of faith to train to do robotic surgery. And I was the
mm,
first general surgeon to do that at Aultman, and really felt that this was something that we could not afford to fail on. If we were going to do it, we were going to be excellent at it. So
mm,
it took me about 8 months from start to finish before I start doing my initial cases. But that did lay the foundation for our training program, and it allowed, folks like Dr. Patibandla, Dr. Beach to just seamlessly work into
mm.
the robotic platform.
So does a medical student see robotics or not? Do they learn robotic surgery in their after um,
I
training?
think I think in most cases, medical students will have early exposure to robotics and advanced technology as we've really transformed the delivery of care. And I think if you look at the three of us, we kind of show the natural progression of how technology has evolved over, our three careers and at different stages.
Mhm. Gosh, amazing.
It is interesting to think about just all your stories and how technology and research has changed how you do things. And I'm certain you can give us some benefits in my next question of what are the benefits of robotic surgery versus laparoscopic versus an open procedure?
Yeah, so I mean the biggest thing that I really like to point out to patients, because it's not, depending on what procedure we're talking about, there's different nuances, but the biggest thing that I try to stress to patients is the movement and the flexibility of the robot. So the robot really allows you, especially in tight spaces, that gives you a human wrist. A lot of laparoscopic instruments are, you think of like a pair of pliers, a pair of scissors where you can open and close, you can twist it. But if you're trying to get in a tight corner, those straight scissors, you're not going to get that angle.
Mm,
In comparison to the robot, which really allows you, whether you're doing a gallbladder or a hysterectomy, to really get access to, where you need to be in tight spaces, as well as there's the other couple differences. Robotically, you get a three-dimensional view. So when you're working normal laparoscopic, you're really just looking at a TV screen. And so it's difficult to assess the depth sometimes. And obviously it's something that you kind of pick up in your training and be able to assess some of the cues that are in front of you.
mm,
But robotically, that is a much more natural process. the camera system actually has two cameras within it, and so it creates a 3D view, so that your depth view is a lot easier to follow along with. And then lastly, the magnification. The camera gives you at least 10 times normal view. So really, if you're in a tight spot and trying to figure out what structures are what, you can really get in close and see exactly what you need to see.
Amazing.
Interesting. And I'm also gonna guess, building on that, that recovery times could be faster and infection risk could be less and things of that nature too.
Correct. Yeah. So, and some of those numbers are not drastically different between laparoscopic and robotic, depending on obviously on the procedure you're discussing. But yeah, correct. It's smaller incisions, less pain, quicker recovery.
Okay, so now a business of healthcare before we take our news break. A Da Vinci robot must be a significant investment for the hospital. How do you measure the return on that investment?
Well, you're correct. There is a capital investment just to purchase the technology. There's the investment of time and training for providers and staff, and so those are decisions that we don't take lightly. We think those out very, very clearly. But if you look at the data, there is some cost savings where we have reduced patients' length of stays in the hospital. We've decreased their pain, the narcotic use after a procedure like this robotically is significantly less. That's been validated in the peer review data. And there's some other soft cost savings, such as fewer conversions from laparoscopic surgery to open surgery. We get our patients back to work and their leisure activities a lot quicker. Some of those things you can't measure, but we know that there's some soft cost savings there.
Yes. Interesting. Are we on the break time, Brad?
Yep, let's do it.
Okay. It is the bottom of the hour. Time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. I guess we're back. Okay. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, we are talking to Dr. Beach, Dr. Kelly, and Dr. Patibandla. So, go ahead.
Okay, I'm sorry. So how has robotic surgery, and specifically the Da Vinci X, is it XI, changed your surgical practice and approach to procedures?
Yep, that's exactly right. So that's a very good question. Kind of like we were talking about earlier, there's different ways to do surgery, whether it's traditional open procedures with a big incision. There's laparoscopic incisions or laparoscopic procedures where you make smaller incisions, and then there's obviously robotics. What I feel is it's changed my practice in the sense that there are cases that oftentimes would be an open procedure from the get-go, and that's classically the only way you could have been able to do that procedure safely. The robotics platforms really allowed me to be able to tackle more difficult cases. Sometimes the uterus is enlarged, so that those patients were typically a open case, and I'm able to do that robotically and essentially laparoscopically, and you get all the benefits of laparoscopic surgery and robotic surgery, and then you without the longer risks and the longer recovery for open procedures. So that's really for my personal preference or how it's changed my practice for sure.
Okay. How has the robot helped you improve patient outcomes in terms of recovery time, pain management, and overall care?
So as Dr. Patibandla kind of spoke about a little bit, I think we all agree it's the less pain, the less infection, and those big pluses. I mean, just as an example for me, just even in the last month, I was doing a gallbladder, which is, as Dr. Kelly will support me, you never know what you're getting with outpatient gallbladders. Sometimes you get in there and everything looks great, and it's like, oh, this will go smoothly. And other times you get in there and you're trying to figure out how this patient has been walking around for however many months and years with this gallbladder looking the way it is. But truly, without that Da Vinci, Paul, I probably would have had to do the exact same that happened to you. I would have had to make a bigger incision if I was laparoscopically, and so truly, save that patient from a larger incision. and the associated pain and discomfort with it, probably would have been an inpatient stay for at least a day or two afterwards because of that. And I just checked on her recently, and she's doing very well. So truly has come a long way in saving some of those patients.
My surgery was 40 years ago, so I'm thinking, today it still hurts. So I think
Yeah.
I think they took it out. Anyway.
I think one of the other advantages that we underestimate is the teaching and training that we're able to do with our colleagues when we use this platform. We have what's called a dual console. So we have two consoles that are hooked up to one robot. And I think Dr. Patibandla can attest that that is really a great way to train. You're able to sit there with a expert and have them coach you through the case, have them help you through the case. And I think it really adds an extra layer of safety to all the training we're able to do. Dr. Beach can be doing a procedure, and I can telestrate on the monitor that he can see. And it really allows us as peers to collaborate with each other to enhance patient safety.
Yeah, I couldn't agree. That's an excellent point. It really made my residency training so much better because it's almost like having a student driver car where another surgeon can basically take over the procedure or telestrate, like Dr. Kelly said, to show you exactly, this is the angle I would potentially do, or this is what I would watch out for, instead of you watching them do it completely and then trying to do it by yourself. Completely separate. So it's invaluable in that sense.
And a good point, which I don't think we've even brought up yet. I know Dr. Patibanda and I have even occasionally done combo cases. And so the ability to have multiple different providers doing different, areas of practice, provide the care to the same patient at the same time on two different consoles, is also very beneficial and unique and can be very helpful to, in certain times when different organ systems are involved, or you want another provider to, hey, is this normal? Is this not? Can you lend a hand here as I'm dissecting around this? And so really is very helpful.
How do you sterilize this thing? I mean, it's a monster. I mean, do you sterilize it?
The console and the what we call the patient cart and the robot, they are cleaned after every case. The instruments that enter the body are called arms, and so those arms are multi-use, and they get sterilized after every procedure.
Interesting. Okay, the robot is known for precision and versatility. How has this technology allowed you to perform more complex surgeries or minimize complications?
I think, as Dr. Beach alluded to earlier, the visualization is superior. This high def 3D visualization is really a game changer when you compare it to laparoscopy. So again, I think that just augments the patient safety. The dexterity of the instruments, where you have wristed instruments, really allows you to become more precise. And you can set the instruments so they have a level of sensitivity that you just don't get with laparoscopy. The wrists of the instruments themselves, they can rotate 540 degrees. My wrists only rotate 180 on a good day. So all those things, I think, just add to the safety for the patient. We also have the ability to simulate operations. So we can actually practice with feedback from the machine as to how we've done on a certain task or a certain part of an operation. I think that's very helpful for the providers.
Okay, so you roll me into a surgical room and I see this big monster. Okay. And what should I think? I mean, I've heard numerous people, I'm not going to have any robot surgery, just because it's simply they think is dangerous, you know. So
I think the thing we like to try to encourage patients is number one is one, it's safe. And obviously the instrument itself can be a little daunting when you're rolling into the room. But it is, we are, as a surgeon, we're in the room with you at all times. It's not like we're down the hall or down the street or at the country club. We are in the room sitting with you. And if there is an issue, we can get next to you and get into the surgery more hands-on very quickly. And so that's always, part of this is the safety of it. And so that's where obviously the hours of training before we even, touch a patient. And, as Dr. Kelly alluded to, there's even some training programs where you can do certain surgeries with computer generated, imaging and all of that stuff, as well as, going to their facilities and practicing on donor tissue.
I think too, as you and Brad have certainly seen, our consumers are much better informed today than they have been in the past. And we'll have patients come to the office and ask for robotics. They'll pull up YouTube videos of the procedure that they're planning to have. So sometimes that's a double-edged sword. You have to kind of talk them back from things that might not be appropriate for them. But a lot of this can be consumer driven. We've just seen that shift in the whole healthcare experience.
Well,
that's pretty amazing. Why don't we take our last break and then we'll have it out of the way?
Sure. You are listening to Health Matters with the Medicine Center Pharmacy. Okay, welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thank you for joining us this morning. Let's get back to the last segment of the show. About every human being in the world is running around with a cell phone now. And a lot of elderly folks, years ago just wouldn't do it. But boy, everybody has a phone now. Have you noticed an increase in patient interest or questions before the technology takes over?
That's a great question. And I definitely do think that, like Dr. Kelly said earlier, there's YouTube videos of many of the surgeries that we perform, and many of the patients watch one of those videos as they come in for consultation for surgery. But the other thing that happens, and this is a natural thing that's happened for years, which is, one of their friends had a surgery a certain type of way, and they tell them their experience with that type of surgery. So sometimes you get patients who told me, my mom had a hysterectomy 30 years ago, and she stayed in the hospital for 3 days, and I don't want to have to stay in the hospital for 3 days, so I'm really worried about that. And then you find yourself educating them about that and kind of explaining to them, many of these patients, Dr. Beach and Dr. Kelly could probably test, many of them can go home the same day, maybe stay over a couple nights, but the amount of recovery is much better. So it's a little bit of, half truths, meaning they understand part of what's going on, and they understand what a robot is potentially, but then explaining how it impacts them and how it impacts their care is really important.
So this is like one of my favorite questions to ask when we get a group of people together like yourselves, and I'm kind of interested to know what you think the future brings for whether it be robotic assisted surgery or just in your particular disciplines. It seems like the only limit is the limit to our imagination. So what are you guys looking for in the next 5 to 10 years?
Yeah, I would agree with you there. I had the good fortune of being on the teaching faculty for Intuitive prior to the pandemic, and would go to Atlanta to their training center, and oftentimes got to peek behind the curtain and see what they were working on in the future. And a lot of those devices are coming to market now. At the Angel auction, you referenced the robot that was there, and that's their latest piece of equipment to the market, and that's called DV5. And the big thing that DV5 does is it gives the surgeon tactile feedback from the tissue, so you can determine how much tension you're putting on that tissue. It alludes to then a safer operation. There's also machine learning and artificial intelligence that's being added, and you can get graded on your procedure. with then a curriculum of tasks or simulations that you can do to help improve your score. So all of those things, I think, help patient safety. And I think you're right. We're only going to be limited by imagination and probably cost. But I think as robotics and technology evolves, it's going to be less traumatic to the patient. We're going to get better outcomes. We're going to have safer procedures, and it's going to be more satisfying for the care teams too. Because I think that we can't forget about that. There's surgeon fatigue. We have workforce issues, so we have to get better and more efficient at everything that we're doing.
Wow.
Anybody else want to chime in on that?
Yeah, I mean, I guess the biggest thing for me, and Dr. Kelly kind of alluded to it. Obviously his viewpoint now is a little bit bigger picture sometimes as CMO and running the whole system in that standpoint. From a general surgical practice, the nice part about Da Vinci and Intuitive is, they have an app that you can really track your cases and track your times, track which instrument you're using and how often and for what length of time. And you can really hone in on where you as a surgeon can make improvements to improve your outcomes and improve your patient care. And then you can even compare yourself on a national database. Which none of that, in my training where I didn't do any robotics, I had access to none of that. And being able to kind of tap into a network like that across the country, across the world is, I don't even know how you measure the amount of benefits you can get from something like that.
Yeah, I absolutely agree. This is one of those things where you do a surgery and you see how amazing some of the technology is, and then you kind of imagine what you think yourself will be in 10 years. And I think, potentially, we have 3D vision, maybe an articulating camera, a camera that can help me see around a corner a little bit better, see straight. We do have something like that. Instrument exchanging, this is something that happens in all surgeries. Is there a way that that can be more efficient? These are just things I personally think of, and I don't know how much they'll make a big difference to a patient's surgery, but I can imagine over time, as these small things kind of add up, it'll end up being a really big thing and move the needle really.
I want to ask a delicate question without offending, but I mean it with all sincerity. And we're all graded in life on everything we do, whether it be how you talk to a patient or apparently how you perform a surgery. How has it changed your mindset as you've gone through your education? And what I'm drawing from is 25 years ago when I was in pharmacy school and had the luxury of rounding with cardiac surgeons at IU Med Center in Indianapolis, there was like some resistance to get some feedback from a pharmacist about a pharmaceutical intervention when a doctor felt that they knew their practice the best. And I respect that. I was just a dumb pharmacist student, okay? But I'm thinking about how challenging it might be to go from I've worked for 8 years to do this discipline, and now this app is telling me that Dr. X is better than me. How do you manage that feedback?
Well, I think the world has certainly changed, and medicine has become more and more multidisciplinary. We have a clinical pharmacist that's embedded in our team. She is invaluable. She has helped patient safety. She's saved millions of dollars, prevented errors. So I think that we have to take the view that we have to live in a world of continuous improvement, and we have to judge each other. We have to be honest and transparent about that as much as we can. And surgeons are very competitive people. If someone says they can do something better than me, I take that as a challenge, and I have to do some self-reflection. The nice thing about the technology is we can record our procedures in a de-identified way and use that as game film, so to speak, and help each other get better. And I think that's the type of community in peer collaboration that the technology allows.
That's really cool.
Okay, what happens if one of these robots breaks down during surgery? Do we have assistance with the physician in there also to take over and help?
Yeah, good question. There's always someone at the bedside. So there's, obviously you have your anesthesia team that's above the patient, that's on what I call the not so fun side of the drape. And then you have your surgical assistant as well as scrub tech. And so those two people are sterile and at the bedside at all times. And so that they're the ones kind of changing out instruments and assisting in any way. And so that way, if there was an issue at the system at the console, then they're right there to handle it. And address things if needed. And obviously, if something more serious were to happen and the machine would lock up, then there are fail safes and things to get things to disengage safely without affecting patients and patient tissue.
Interesting. I was told in that event last year that these robots are constantly upgraded. Is that true?
Yes. Yeah, the software gets constantly upgraded. There are improvements to instrumentation. Um, I think Intuitive has done an excellent job of continuing to push, although they're the only FDA approved robot system in the United States. They could sit back and be fat and happy, but they are constantly pushing the technology and pushing the providers and pushing for better clinical outcomes, quality, and safety.
Interesting. Well, doctors, we're pretty short on time. What are your parting words to the listeners as it is time to sign off?
Sure, I'll start. You kind of brought up an interesting point early on about, cell phones and how life has changed and how, 30 years ago was completely different. You couldn't imagine it. So, that's how medicine is and that's how surgery is. The world changes, and the nice thing about medicine is we really try to strive to make it our outcomes for patients better, to make sure they have less pain, less complications, faster recovery time. And these things are important. And I think that's where the natural evolution of laparoscopic surgery is. And that's where robotic really is a game changer and really helpful for us. So I think as time goes on, things will continue to evolve, and things that we do now will seem antiquated in 15, 20 years.
I'm 80 years old, and I have really seen in my lifetime, because I've been a pharmacist for close to 60 years, and it's amazing what we've seen in the drug industry, meds, all different kinds of things to help people, and in surgery and in hospitalization, all that. My gosh, just amazing what I've seen. So.
I think despite our technology and the advances we've made in healthcare, it still comes down to a human interaction, though. And medicine is very relational, and we can't forget about that.
Mhm.
Agree. All
Anybody
right,
else?
Dr. Beach, you got anything? We got about 30 seconds for you, buddy.
No, I guess just to tackle, jump on what Dr. Kelly said. Don't be afraid to ask questions as the patient. I mean, there's a lot of nuances to a lot of this stuff. And us communicating it to you is part of our job and what we enjoy, and then you kind of get to see our passion for what we do. And so don't be afraid to ask those, what's the difference and how is this different from what you used to do, and what are the, all those little details that may really benefit you before and after surgery.
Wow.
Excellent.
Okay. Thank you to our guests, Dr. Beach, Dr. Kelly, and Dr. Patibandla.
Thank you.
Thank you.
If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Aultman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here on News Talk 1480 WHBC. Thank you very much, doctors. Very interesting. And it's very unusual to have three doctors at one time, but boy, it was great to hear
Thanks, Paul.
Appreciate
hear all the angles and all that kind of stuff. And the like I said a few minutes ago, they're just overwhelming when you think from my age period, when you think what the heck's going on here. I remember one thing a while back that when they were doing knees and hips, the sales rep of the company that makes the product was in the surgical room in a particular hospital around here and showing the doctor, the surgeon, how to do it. How about
Brought
that?
to you by friends and family.
Thank you very much. I guess they're kicking us off the air.
All right.
Yeah.
No.
Thanks, doctors. Have a great day.
Yeah.
Thanks, you too.
Take care.